Imagine going to the hospital to get treated for something and leaving with another infection. Or borrowing a friend of your shirt for tonight's football game, and when you go to take it off, you see small little red bumps all over your skin. Well, these kind of things happen every day from a contagious bacteria infection called methicillin-resistant Staphylococcus aureus, better known as MRSA or the superbug. This infection received the name superbug because it is resistant to several antibiotics. The most basic level of MRSA is a type of staph infection, which many people get. CDC states 25 to 30% of all people have staph in their nose. There are three main sites you most commonly see this bacteria infection: in the soft tissues, the lungs, and the bloodstream. MRSA is easily contracted in our society. Once contracted, the symptoms are obvious. However, there are simple measures everyone can follow to prevent the contraction of this infection. There are two types of MRSA people can come in contact with. One is hospital-associated MRSA, which you can contract in a healthcare setting, such as nursing homes and hospitals. The most frequent causes in hospital settings are surgical wounds, bloodstream infections, and pneumonia. This infection lurks in areas of the hospital where it is crowded, such as the waiting rooms in the ER, where poor hygiene exists. Patients all over, of all ages, are waiting side by side to be treated for various problems, such as open wounds, abscesses, and boils. Also, the infection is seen in patients' hospital rooms and where they're being treated for surgical procedures. The nursing home is another area MRSA is spreading. The infection tends to strike older people who are very ill with a weak immune system, and also residents wearing catheters. The other type of MRSA people can contract is within the community. It's called community-associated MRSA. This is where you have skin-to-skin contact with others or contaminated items. Some of these main areas are dormitories, schools, and department stores. When you come in physical contact with contaminated items or objects, I will name a few of them to give you a better example of what we come in contact with every day. Things such as clothes, door handles, shopping carts, sinks, and floors. Skin-to-skin contact can be very dangerous because even if people are not infected with but are colonized with the bacteria, it can still spread. There are many different signs and symptoms to look for when you think you have contracted MRSA. Generally, the skin infection starts with a small red bump, such as a pimple, and this can turn into a deep, painful abscess if not found immediately. Such as on my board, these are different types of skin infections caused by staph, and this is an abscess right here on the right-hand side, where you see it's deep into the skin. The infection can also penetrate into the skin and will have symptoms such as fevers, chills, joint pain, and shortness of breath. These signs are more dangerous because when the MRSA is spread like this, it is in your internal organs and can be life-threatening. As soon as a person sees another sign or has any of these symptoms, they should immediately seek medical attention. A medical provider uses a few different ways to treat people with this infection. The treatment will depend on how bad the MRSA is. Some infections are treated with certain antibiotics, such as Bactrim, doxycycline, and vancomycin. Also, some are treated with nasal cream. They also recommend a soap called Hibiclens to clean your body when you have this infection. If a person has an abscess on their skin, the doctor may drain it and bandage it well until the infection is gone, so it's not spread. If a person does not seek proper attention for the infection, they can end up hospitalized, or in some cases, it can even be fatal. Science Daily states MRSA is responsible for over 18,000 fatalities a year. Although it seems to easily be contracted, the contagious disease can be prevented also. The number one way to help prevent this infection is to wash your hands. There are 5 steps to properly wash your hands. As you can also see at the bottom of my poster, someone is washing your hands because that's the number one way. The proper way is to wet your hands with water, apply the soap, lather well, rubbing your hands together for at least 20 seconds, and some people say recite the alphabet while you're doing it. Include the back of your hands, your wrist, between your fingers, and under your nails. After you finish, dry your hands with a towel, and with using the towel, turn off the lights, the faucet, and open the door with it so you don't get any more germs from it. Also keep antibacterial soap handy because it is the second best way if you don't have a sink and soap near you. Another way is to keep personal items to yourself. Avoid sharing clothes, towels, razors, and if you're an athlete, don't share athletic equipment. Also keep all wounds covered. Use bandages until the wound is healed, because if the wound has pus in it, it can contain MRSA, and keeping it covered helps it from spreading to others. Also, hygiene is important. Shower after each day. This helps get rid of any bacteria that you have come in contact with that day. If you are in any type of sports, you should not play or practice if you have any type of open wound. Also, sanitizing all your linens. If you have any open wounds, like bed linens, clothes, and towels, will help prevent any spread further of the bacteria. But most of all, get tested. If you have noticed any unusual places on your skin, or you feel funny like chills, dizziness, or headaches, you should go immediately and get tested. The infection spreads fast. Get yourself treated before it gets out of hand. Although the MRSA infection is very prevalent in our society, we can all follow simple preventative procedures to lessen the spread of this infection. Thank you.